Why is diabetes a risk factor for pancreatic cancer? Imagine a condition that quietly influences many parts of your body, sometimes signaling danger before symptoms even appear. That's what makes understanding the link between diabetes and pancreatic cancer so important. Diabetes, especially type 2, is considered a risk factor for pancreatic cancer because of several interconnected biological processes that can promote the development and growth of tumors in the pancreas. In type 2 diabetes, the body's cells become resistant to insulin, a hormone that helps regulate blood sugar. To compensate, the pancreas produces more insulin, leading to high insulin levels in the blood, a state called hyperinsulinemia. Elevated insulin and insulin-like growth factors can stimulate pancreatic cells to grow and divide more rapidly. This increased cell proliferation, combined with the inhibition of programmed cell death, creates an environment where cancerous changes are more likely to occur. High blood sugar, or hyperglycemia, is another key factor. Chronic hyperglycemia generates harmful byproducts known as advanced glycation end products. These molecules cause oxidative stress and inflammation in pancreatic tissue, damaging DNA and encouraging cells to become malignant. Elevated glucose levels also seem to facilitate the invasion and spread of cancer cells by affecting interactions within the tumor environment, making it easier for the cancer to grow and metastasize. Diabetes is also linked to a persistent, low-grade inflammation. Fat tissue in diabetic individuals releases pro-inflammatory substances like tumor necrosis factor alpha and interleukin-6. These substances not only worsen insulin resistance but also promote tumor initiation and growth. The ongoing inflammation can impair the immune system's ability to detect and destroy abnormal cells, giving cancer cells a better chance to survive and multiply. Changes in the structure of the pancreas caused by diabetes can also contribute. For example, pancreatic duct enlargement and increased pressure may create a more favorable environment for tumor growth. The altered tissue environment supports cancer cell survival and invasion by providing growth factors and suppressing immune responses, which can help the tumor establish itself and spread. Interestingly, the relationship between diabetes and pancreatic cancer is bidirectional. Long-standing diabetes increases the risk of developing pancreatic cancer, but pancreatic tumors can also cause diabetes by disrupting normal pancreatic function. When someone develops new-onset diabetes within a few years before a pancreatic cancer diagnosis, it can sometimes be an early warning sign. The tumor may interfere with insulin production or glucose regulation, making new diabetes a potential indicator of underlying cancer. Finally, at the molecular level, diabetes-related metabolic disturbances can lead to genetic mutations and instability in pancreatic cells. Changes in signaling pathways involving molecules like nuclear factor kappa B, leptin, and PPAR gamma are also involved in linking diabetes to the development of pancreatic cancer. All these factors, hormonal imbalances, chronic high blood sugar, inflammation, immune system effects, structural changes, and genetic instability, combine to create a tumor-friendly environment in the pancreas. Recognizing the connection between diabetes and pancreatic cancer is crucial, especially since new-onset diabetes can sometimes serve as an early warning sign. If you have concerns about your health, it's always best to talk with a healthcare professional who can provide personalized advice and screening options.